Why we hurt the very people we should love. Abuse. Tonight, on Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. Dr. Home is off tonight. I'm Lindsay Myers with Avera Health. According to the National Domestic Violence Hotline, 1 in 4 women and 1 in 7 men in the United States have been the victim of severe physical violence by an intimate partner in their lifetime. And when it comes to children, they suffer too, from physical, sexual, emotional abuse, and over half of all children experience neglect. Often the person knows their abuser well. They can be a partner, family friend. You may be surprised to know it's seldom a stranger who abuses. Why is it that we sometimes hurt the very ones whom we love? That's the root of our discussion tonight. But first, tonight's Prairie Doc quiz question. Why don't victims leave an abusive relationship? A, the victim fears the abuser's violent behavior will escalate. B, the abuser has threatened to kill the victim's family, friends, children, pets, and him or herself. C, the victim loves the abuser and believes he or she will change. Or D, all of the above. Viewers who call in the correct answer will be entered into a drawing to win a signed copy of the book, The Picture of Health. Each of Dr. Home's essays written originally for the show come with a wonderful accompanying photograph by Dr. Judith Peterson. We'll announce the answer to the winner at the end of the show. And remember, you only have 10 minutes to get your answers in. Joining me tonight in the studio is Dr. Wallace Jackman, a psychologist with Avera Medical Group, University Psychiatry Associates in Sioux Falls, and Dr. Nicholas Torbert, a pediatrician with Avera Medical Group, McGreevy in Sioux Falls. Thank you both for being here tonight. So why don't we start out talking a little bit about your background and training. So Wallace, why don't you start and tell me where you went to school and what you've done up to this point?
Well, I received my bachelor's degree in social work from Augustana College, which is now Augustana University,
Sure.
and my master's degree, University of Nebraska, Omaha, in social work, marriage and family therapy, and I completed my PhD training about 10 years ago through Capella University. I've been employed for the state of South Dakota in child protection for several years. I worked at an old charter hospital that used to be here in town and the mental health center here for about 3 or 4 years. And I've been employed with Avera for the last 15 years at University Psychiatry Associates. I also do some teaching through the University of South Dakota School of Medicine and the MSW social work program.
And do you specialize mostly in children, or do you see people of all ages?
Well, I'd say one of my specialty areas is children and adolescents, yet I'd say my practice has kind of morphed in the last 15 years or so, that I primarily see adults now with some adolescents. I probably see about 80% adults, 15–20% adolescents, 1 or 2 children sprinkled in there now.
Okay. And Dr. Torbert, how about you?
I grew up in a small town, Gettysburg, South Dakota, in the northern part of South Dakota. I moved to Rapid City and finished high school there and did undergrad for the most part at University of South Dakota. I did medical school in Des Moines and then pediatric residency at the University of Nebraska Med Center, Creighton, and Children's Hospital in Omaha. Before I did a year of fellowship in neonatology at the University of Minnesota, and I've been with Avera Medical Group now for about 2 years.
So you're pretty new to Sioux Falls and the Avera system?
I'm pretty new to the Avera system, but I love it. It's been great.
Good. Well, we're glad to have you. Please call in your questions tonight. The number to call is 1-888-376-6225, and our topic tonight is abuse. So we're going to start with you, Dr. Torbert. So first of all, what constitutes abuse in a child?
I will tell you that we split abuse into about 4 different categories. You alluded to those before: physical abuse, sexual abuse, neglect, and then emotional or verbal abuse. And each one of those has a little bit different definition, a little bit different criteria for diagnosis. Physical abuse, when we think about the diagnosis of physical abuse, we really think about signs and symptoms that don't make sense with the clinical situation or scenario. So if a child comes in that is not walking, maybe a 4-month-old, and he has a femur fracture, clearly that did not happen accidentally. And so those are things that we look for from a clinical standpoint. Sexual abuse is children engaging in sexual activity before appropriate and inappropriately, and that is difficult to discern occasionally, but we really try to lean into the kid's knowledge about that when diagnosing it. Neglect is the third thing, and that is just not giving the child what he or she needs to reach appropriate development emotionally, physically, and mentally. And then the fourth thing is emotional or verbal abuse, and that is even more difficult to diagnose, unfortunately, because oftentimes we have to know what is going on in those situations.
And I imagine it's difficult even with physical abuse sometimes. I mean, I have 2 children myself, and kids get bumps and bruises, and is it tough to tell what's normal for a child and then, what's an unusual injury?
Yeah, and I will tell you that much of a pediatrician's training is kind of discerning some of those different things, and we understand that toddler boys and girls are prone to accidents, and so they're going to come in with bumps and bruises and things like that. But if I see bumps and bruises on, as I mentioned before, an infant, that's inappropriate, and we need to talk about that a little bit more. If there are burns that happen on a patient that meet specific criteria, that's something that I delve into a little bit further. So it really depends, but that's why we come to the table with clinical knowledge, hopefully, and some experience.
Like a cigarette burn or something like that?
Exactly,
Okay.
exactly.
And Wallace, are there certain groups that are more often abused, that it's more prevalent in?
Well, research supports close to 50–60% of abuse cases are emotional and verbal abuse, and groups that would be more prone to any types of those abuse would be lower socioeconomic, sometimes racial, neighborhood kinds of things can be an issue. Lower education is a risk factor. Obviously, alcohol and drug issues in the home or in the family are also risk factors. Children that have some type of developmental disability are at higher risk for abuse, and children and adolescents that have the developmental delays, developmental problems, things of that nature might be at risk as well.
And it can really, be anyone who could be abused, though, even though it's more prevalent in some groups. I remember being in college and reading a book about very wealthy women who are abused called Not to Women Like Us. And,
right.
Do you see that in your practice?
Oh, most certainly. And I'd say the groups it doesn't mean that the middle to higher income folks don't have abuse,
Sure.
by no means. But generally speaking, those folks are going to have less stressors, so the percentages might be a little bit lower, but yes, those groups can have, I see some of those folks in my clinic. I'd also say conversely that the folks that have more income or are better able to hide things or better have resources. For example, I had one child that I'd seen that was being abused, and the family was wealthy enough to where they could send that child away to another state or in a facility or put them in a group home, and so they're able to use those resources to maybe cover things a little bit better than folks that are in a neighborhood in which those types of things are going to be seen and viewed by others much more easily.
Wow.
I would echo what Dr. Jackman said. I think in the pediatric literature, we know that abuse probably is more common with the folks in the lower socioeconomic classes. However, it's the folks that in the middle to upper classes that we miss, unfortunately. And so those are the percentage of folks we're just not diagnosing them, unfortunately, as well as we should.
Well, we're going to talk more about those warning signs that people should look for and how to seek help when we're back in just a moment. Recently in Sioux Falls, Avera Health, Children's Home Society, and the Department of Justice hosted a conference on child sexual abuse with over 400 attendees. We visited with 3 of the presenters at the conference. Here's more on the work that's happening in South Dakota.
If we woke up tomorrow morning and there was a headline that 4,000 children in South Dakota were infected with some disease, I think all our communities would be up in arms. And that's the number that we're dealing with in South Dakota on an annual basis, that 4,000 children are being sexually abused. It needs to be addressed. We need to ensure that people who work with child sexual abuse are being recognized. We need to make sure our laws address this issue, and we need to hold the perpetrators accountable.
Because the sexual part is one aspect of it, but really it's more the power and the control, the manipulation of these predators that allows them to do what they do.
One of the scariest things to a perpetrator of child sexual abuse is having it disclosed, having to face the harsh reality and the harsh lights of a courtroom with an empowered victim who's ready to take the stand and testify and disclose the sexual abuse.
Jolene's Law Task Force this past year brought forward an effort that I was happy to shepherd in the legislature to fund a Center for Child Maltreatment at USD. Now, while it's housed at USD, it's going to be working with all of the universities, public and private, as well as the technical schools and law enforcement, where there are mandatory reporters. We understand through our research that the most powerful change is to change what the mandatory reporters know. And think of us, there's so many of us. I'm a nurse, and you think of all the doctors, counselors, social workers, teachers, ministerial people, law enforcement that have statutory responsibility to be a mandatory reporter, and yet we know very little about child sexual abuse, how to look for it, how to open up the conversation. So we want to change through undergraduate and graduate education what everyone knows on a consistent way about child sexual abuse and child maltreatment overall.
The first day of trial, I heard one of the victims speaking his truth, and in doing so, I realized for the first time that I wasn't the only one. For most of my life, I thought I was the only one that he had ever done this to. I could never grasp that, or to think that he had done it to someone else. And so it was in that moment where I realized I wasn't alone, and I saw the courage and the strength of this young man to speak his truth in front of all kinds of media and the world, so really, and I wanted to at least send him a message that I believed him, that I knew he was telling the truth, and the only way I could think to really do that was through my own disclosure.
What I'd love to see them do is to start having conversations in their places of influence. Even in your own family, just start to talk about it. Talk to your own kids about it. Talk to the kids that walk through your doors. Follow the efforts of Jolene's Law Task Force. If you look at the Department of Health website under News, you can click on News and you'll see a link to Jolene's Law Task Force. Start to talk within your church. Have a conversation about people that are coming into your church and taking care of kids. Look at when are your children vulnerable with coaches and counselors, and when are they in areas where, as a parent, you have that funny feeling, you have that instinct, this doesn't seem right. Trust your instinct. Follow up on it. If your child, of course, children, over a lifetime start acting goofy for many reasons, but if there are certain things where this just doesn't seem right, something's different, something significantly different. Maybe it's school, maybe it's their learning, maybe they're being bullied, maybe they're frightened of something, maybe they don't feel well, but add this to the repertoire of conversation. Has anybody ever touched you? I just have to ask.
My message is simple: report it. Tell the authorities. Let them handle it. There can be no second thought about it. If you're thinking it, it's probably happening. There's a reason you're thinking it. Report it and allow it, protect the child. I'm always on the side of a child and a survivor of child sexual abuse.
If you see something, say something with respect to child sexual abuse. Don't be concerned. Jerry Sandusky, coaches, others in our community, neighbors, only 10% of the cases of child sexual abuse are committed by perpetrators. The remaining 90% are committed by individuals with whom the child is familiar. And of that number, 30% are family members. So it does happen in South Dakota. It's happening in our towns, in our communities, in our neighborhoods, and in our families. And we need to address it as we go forward.
This is your show, and your questions are key to our show discussion. Call in your questions about child, domestic, or elder abuse to 1-888-376-6225, or send us an email at ask@prairiedoc.org. Well, we're back to answer some more questions tonight. So Dr. Torbert, let's start with you. So how prevalent, we just heard this package about child sexual abuse. It's so sad to think that that happens, and how prevalent is it?
I will tell you that it's difficult to say because, unfortunately, we don't diagnose all the cases that are occurring, and so it's hard to get an accurate estimate about what's happening out there. There are some studies that would say around 2.5 per 1,000 kids are abused. Another study would say up to 87 per 1,000 are being abused. Honestly, I would say that one, it depends on the diagnosis and what we qualify as a diagnosis. There's a lot of sexual activity, unfortunately, in our kids under 18, and so if we're talking strictly about sexual intercourse with kids under 18, that number is probably a little bit lower. However, if we talk about some of the other things that our kids are experiencing, exposure to pornography or explicit material, flashing, things like that, that number is probably a little bit higher. And so it depends on what we decide the diagnosis or definition is, but it's significant.
And Wallace, you spoke at this conference, so did you have any takeaways that you wanted to share with folks that you thought were, pretty amazing to you from the conference?
I think one of the takeaways I had from the conference was the necessity of folks in the field being trained to spot abuse and to be able to report it correctly, and the Child Protective Services needing to be trained better. I mean, it's unfortunate that we have so few resources at our disposal to investigate cases, and so that's one of the things I really took away from that, is the necessity of us putting more emphasis on not just training professionals, but prevention. Prevention, I think, is key as well.
And they're mandatory reporters, and many of them came to this conference. So who is a mandatory reporter?
Well, we are. Most
a big
professionals
job.
that are, yes, it is. Generally speaking, any professional that is in contact with children and adolescents, whether it be teachers, psychologists, counselors, social workers, physicians, they are generally supposed to be mandated reporters. And sometimes folks, I do some teaching, like I said, through the med school and through the MSW program. So when I speak to the students, they're thinking, well, that's just in my clinic that I'm supposed to report. No, that's in the grocery store. That's if you're driving down the street and you see a child being hit in the back of the head, in the back of a car in front of you. You're still mandated to report suspected abuse, even in those situations.
And you always hear, if you see something, say something. Is that an
Right.
important rule?
Right.
Yeah.
In fact, I remember when I worked in child protection, most of the cases we were able to prosecute, or at least substantiate, were cases in which neighbors or someone driving down the street or someone in the grocery store saw something and they reported it. And we had eyewitness individuals that saw those things happen. And if they hadn't done that, we may never have received the referral from a physician or from a professional as myself.
When I speak with other professionals about being mandatory reporters, some of the things that people are nervous about are, if I say something, then the kid is going to end up in foster care or be taken away from the home. And I think the message that I have is really that is not true necessarily. We're really building cases, and we just want to make sure that the kids here in South Dakota are healthy, that they have a good environment and are being supported by the community and their families. And so if you can play a part in that, I think it's so important to just call. And nobody's going to act on one call or things like that. But it's important to make sure that, boy, we're all looking out for those kids.
What are the steps in reporting abusive behavior? Because that's an important takeaway for everybody watching tonight. If you see it, then what do you do? Should you call the police? Do you call a shelter? And how important is a plan before doing that?
Yeah. So what I tell my parents and some of the professionals that I work with is the Department of Social Services is a great contact information. If you're ever in doubt, you can certainly call the police department, and they will help you in where to talk about that. A lot of times information isn't divulged to you as someone that has observed it, but that is usually given to a social worker or something like that, so that, the information ends up in the right spot.
Sometimes I've had patients ask me, hey, do you think this is abuse or something that I should report? So that might be another avenue that our listeners can go is talk to your social worker that you know, or talk to your pediatrician, talk to a counselor and see what they say if they think that's something that's reportable. Because there's been cases where I've had to have my patients come with me and make those reports.
Yeah.
Can you report anonymously too? Like if you know your neighbor is being abused and you're sure of it, or do you need to report your name?
Well, we're supposed to report, by our name.
Sure.
But the public, yes, they can call in anonymously. I'm guessing CPS, Child Protective Services, would want the person to say their name so they could come back to them to get more information.
Sure.
But yes, you can report anonymously.
And how important is it for somebody to have a plan, especially with those domestic abuse victims, to before they leave, to know where to go and be able to take their kids out of that situation?
I'm not. So the question is, plan like a safety plan?
Yeah.
That's extremely important. I mean, it's one of the most important pieces, whether it be the victim or survivor is attempting to report it themselves, that they have to feel safe, and there has to be, sometimes a safety plan is developed even before the report is made. So for example, if I'm working with an abuse victim, I might start developing a safety plan like hiding your keys, getting birth certificates out of the home, getting family heirlooms with a safe person, what can you do in case the things escalate, that you're able to leave the home safely so that the keys aren't taken away from you, having a bank account. So many of those things need to be developed hopefully before the act occurs. But sometimes in cases where it's an emergency, they just have to know where those resources are available.
That's right. And I think it's so important that if you or someone that you know is in a situation that is unsafe, you feel imminent danger, then you call the police or you get out of that situation.
Right.
And a plan is not necessarily, has to be, I think it is perfect if it can be made, but we really want those people to be safe and,
Correct.
And to be
Yes.
around
And
folks that.
abuse victims can show up at places like shelters, children's inn, places like that,
Correct.
When they're in that emergent situation.
Right.
Yes.
Yeah, hospitals are another thing.
Yes.
Okay.
So going to the emergency department, and sometimes you can even use that as an excuse maybe to go in or to
Right.
leave the situation
Right.
that, boy, Johnny, he's got a fever and so I have to take him in and things like that. And that's a safe place.
Right.
Absolutely. So something with the Child Sexual Abuse Conference I was so shocked about is how long abuse can go on before it's found. How long do you find that, or how often do you find that in victims that it goes on for sometimes years?
It's devastating, yeah. And sometimes decades. It depends on
Wow.
who the perpetrator is and what that relationship is like. You alluded to earlier folks being that knowing their victims, and so if that happens and if they're around them, it can be a long time. It's difficult to say on average how long those things last, because as I mentioned before, unfortunately we don't pick up on a lot of those cases, or a lot of them are hidden, and so it can go on for quite a while.
And we do know a majority of, whether it be rape, sexual abuse, physical abuse, but generally speaking, sexual abuse, the victim knew the perpetrator. And it's usually a family member or a lover or someone that they knew.
And I imagine with our aging population that elder abuse is really becoming more prevalent now too. Can you talk to some of the signs that people should look for in elder abuse and what to do if you feel somebody's being abused?
Well, I believe some of those same symptoms that we'd have with adolescents and children and adults would be similar. I mean, obviously any marks or bruises, things of that nature, a physician would likely pick up on. Any reports made by the elder person, that they're saying that their finances are being taken, or they're not eating, maybe be some weight loss, more depression, more anxiety, more visits to the physician. I think any of those kinds of things would be possible signs that there may be some abuse.
And same thing for these folks, they should go to the emergency room or to a shelter if they're experiencing abuse, or tell somebody. It could be happening in a nursing home setting or an assisted living or something like that.
Yes, I think they are a population similar to younger children that aren't going to school, that are at a higher risk because they may be dependent upon that caregiver that is abusing them. It could be their their son, maybe their only daughter, and if they were to report, then where would they go? You know, maybe they're able to still stay in their home, but if they report, they're afraid they may get sent to a nursing home or something. So it puts them at a higher risk to make those reports, but yet there are resources available for those folks, and I would strongly urge them to make those reports to trusted others.
That's right. And that's why I think that it's so important that we as healthcare providers, nurses, social workers, the people in the community are so vigilant to pick up on some of those risk factors and just the demeanor of the people. You know, if somebody's coming into coffee and has for the past 15 years, and then all of a sudden they're more withdrawn or have some marks or aren't coming into coffee as often, I would say that that is something that I would be concerned about because it's uncharacteristic. And so I think we here in South Dakota, we have it's just an advantage because we're such a close-knit group of people, and so it's just an extended family. And so if we can watch out for one another in those different respects, I think it does the community a world of good.
Such important advice. We'll be back in just a minute more in studio. No one should ever have to live with abuse. It's important for people to know there are safe places for them to go for themselves and their children where their abusers cannot hurt them. It's important to have a safety plan when leaving an abuser. Domestic abuse shelters are a safe place for you to escape from an abuser. Here's information on some of the work happening at these shelters.
Since I've been here, the youngest person that has come here for her own safety was 17. And a mother herself. That can get tricky for us if they're minors. And then I think the oldest person, gosh, 70 maybe, just to give a ballpark there. But domestic abuse really doesn't discriminate on any demographics. And so that's one thing when we do our community presentations that we really try and drive home is that it can happen to anybody. We also serve males. We can't house males in the same facility as our female clients, but we will find them shelter if they are in need of shelter. Domestic abuse is about power and control. So it doesn't necessarily need to be physical abuse. There's emotional abuse, psychological abuse, verbal abuse. Oftentimes, those are kind of precursors to physical violence. However, we like to tell people, you know, just look for the power and control, financial control, controlling who you're with, if you can work, if you can go to the store by yourself, little things like that. Early on in a relationship, some of those things can often be seen as, oh, this person really likes me a lot. They just want to know where I am all the time. Don't want to be without me. But usually those are kind of red flags. If you see a change in your friend or family member, you know, usually self-esteem is affected a lot. And so you might see them not taking interest in spending time with you anymore or doing things that they used to do. Appearance could change. It can really take a big toll on physical health as well. So those would be, you know, really careful things to look at. And then just, you know, listening to the little things they say. It's often minimized by even the victim because they're led to feel like it's their fault or they somehow deserve it. Even just saying, I believe you, I'm here for you, can go a long way. The Walk a Mile in Her Shoes is a fundraiser that we do, and that's to stand in support of survivors of sexual assault. So we serve victims of sexual assault, stalking, and domestic abuse. We do a few other fundraisers. The community supports us so well. We are so lucky to have such a supportive community.
We're back talking about abuse. If you have questions tonight on this topic, call them into 1-888-376-6225. So we have a question from Mitchell wondering if we see different cultural boundaries for child discipline, what's acceptable and unacceptable for discipline, Dr. Torbert, and where's that line between discipline and abuse, I think?
Yeah, that's a great question, and I will split that up into a couple of different categories. One, obviously physical abuse is a concern when we talk about discipline. The hard and fast rule that we typically go by is any discipline should not leave any sort of physical mark. I will tell you that the American Academy of Pediatrics has put a very firm stance that spanking is inappropriate, and there are other, probably more effective ways in dealing with behaviors that are not acceptable. And so that is what I tell my patients all the time is spanking really probably shouldn't have a large role or a role at all in a household. And it's difficult when folks have grown up with that tradition. The other thing that I will say is verbal abuse, like we talked about before, is difficult. And so one of the things when I'm in clinic and I have patients that are bouncing off the walls and parents are becoming more irritated and things, they will say, please don't do that. I don't like what you're doing right now. And I think that that is a perfect way to handle it, because if you can target their behavior rather than their character or personhood, that is really kind of a definition for me between abuse and discipline. And so if you catch yourself when you're irritated, which is difficult to do, but I would make sure that you are targeting the behavior that you feel is unacceptable rather than saying you're a bad kid because you did this. I would say, I love you, you're a good kid, I don't like it when you do this, and that was unacceptable. That really takes the target or the accusation off of the person or the character and really places it on the behavior.
So saying, I don't like your behavior rather than I don't like you.
Exactly, exactly.
And I kind of piggyback on some of what you'd said about the parents and discipline. I believe a majority of parents love their children. And so what I will tell those parents that consider spanking or harsh discipline is that we know from research it puts those children at risk for many, many problem kinds of things. So for example, it puts them at higher risk for suicide, it puts them at higher risk for drug and alcohol abuse, it puts them at higher risk of dropping out of high school, teenage pregnancy, higher risk of major depression or a bipolar or a mood disorder, higher rate of anxiety disorders. I mean, the list just goes on, a higher risk of bullying or being bullied. And so all of those risk factors, that's what I will tell parents, that if you decide you're going to use corporal punishment and discipline, then you're likely putting your children at risk for some of those problems.
And it's really difficult for kids that are not developmentally appropriate or mature enough to know, well, if mom hit me because I did this bad, then why can't I hit one of my classmates that did something bad? It doesn't make sense in their head. And so that's one of the reasons that I will sit down with parents and say, here's the thing, it's just not going to be effective, and you're not going to see the behavior change that you want to see.
Children don't know how to rationalize
It's just difficult.
What's going on around them. Let's talk a little bit about who abuses. So Dr. Jackman, is it men who abuse more or women who abuse people more, or is it equal?
Well, if we're speaking of versus domestic violence, interpersonal violence versus child abuse in the home, we kind of have two camps. We know the mean age of abusers for domestic or violence with children is around 30, 32 years of age. We also know the most violent group is age 16 to 24. So young parents are typically going to be the more violent. As far as interpersonal violence, we know that men and women are about equal as far as violence towards each other in a couple relationship, but women get injured more. Women have more injuries, but the rates are about equal.
So oftentimes we think of women as more nurturing and the caregivers, but they actually can be abusive as often as men.
Yes, that is true, and unfortunately most men do not report or will not report for many reasons. Primarily their masculinity might be questioned, or the validity of the report being questioned. But again, I have to state that the women that are being abused tend to have more injuries. They're going to be, and that's because the men are going to be more physical.
Something I thought was really interesting during the conference that we just had not long ago was a comment about people who are abused. Are they necessarily more at risk about becoming abusers or not?
You want me to answer?
Yeah, I'd love to answer.
That's a big one for me.
Okay.
Research clearly supports folks that are abused do not end up abusing other people. I mean, it's a high percentage, 75–80% of folks that have been abused do not end up abusing other people. So unfortunately, I think the media or whatnot paint a picture that if you've abused, you're going to abuse, and that's just simply not true.
And do you think that doesn't happen because those people understand, the detrimental effects that it had on them, and they just choose to not carry that forward, or?
I believe that plays a significant role in that decision to not do that.
Yeah, that's a big deal.
Mm-hmm.
So again, let's hit, where can people seek help if they're being abused?
I come at it from a medical standpoint, and so I think that's why having a primary care physician is so important. You can always find help with those individuals. Like we mentioned before, we're mandatory reporters. The nurses that we work with are mandatory reporters. And so if you feel like you are in an unsafe situation and you find yourself at the clinic for any reason, it's important to divulge that information. One of the things that I talk to especially my adolescents about is, are you in a safe place at home? Do you feel safe at home? Do you feel safe at school? And all these conversations that I have with adolescents happen without a parent in the room. I think it's important that your providers are doing that you get time with your providers just one-on-one. And if that's not happening, then I would either ask for it to happen or find a different provider.
Good advice. I do want to mention, because we've been talking about our conference we just had, that there's an upcoming Domestic Violence Institute that's going to happen at the Swiftel Center in Brookings, and that's going to be Monday, October 3rd through Wednesday, October 5th. So if people are interested in being able to attend a conference, they can go to that one. Often the first help to an abuse event are the local police. How do they see their role in ending the dispute, and what other forms of abuse do they see?
What we first experienced years ago from once or twice a month, at that point it became maybe once a week. And now I'm afraid to say that we're experiencing this almost every day. We are probably averaging throughout the year a report every day of domestic violence. Some of it is nonviolent. We get there, it was just an argument, and so there's nothing that we do in the shape or form of an arrest. And then we get into the victimization part of it, where you have the victim who is afraid to report because she's totally dependent on her husband or on her significant other, and they're still that emotional that they want something done. They just don't want him to get into trouble, and you don't always know what to expect. That's where a lot of times our communication staff are very critical in asking those questions ahead of time, so when we get there we kind of have some idea of what's going on in that home before we get there. Again, if there's weapons, if there's been fighting, who made the call? Was it one of the people in the house? Was it a child in the house, or was it a neighbor? And if it's some outside person, chances are when nobody in the house has made that call, they're probably not going to be real receptive to our appearance. And so again, it's domestic violence, and the calls to domestic violence are probably one of the most dangerous things that a law enforcement officer can respond to. And so we train constantly on that. Elder abuse consists of anything from physical abuse to neglect to financial fraud, which is considered abuse, and in some rare occasions sexual abuse. Probably what we experience the most here in Brookings is going to be fraud. It's going to be attempts on that elderly individual to take something of value from them, money. And so there's all these scams out there that exist, and we've dealt with them. There's such a wide variety. Just today, I was sitting with one of my officers, and he got a call from the IRS stating they were filing suit against him for income tax violations. And that's the most recent one. And if they can load up on someone who's elderly that will buy into that, because let's face it, our elderly are maybe a little bit more trusting. I think the key here is to report, and it's just like with any abuse or violence, whether it's to a child, whether it's to an elderly person, whether it's to a marital situation that's gone bad, to call, to report it. it goes back to the favorite saying now, if you see something, say something. If you hear something, say something. Don't just ignore it. Even if there's nothing to it, we don't mind. We'd rather have people safe. And if there's people that are having problems, we want them to get the help that they need.
And we're back tonight talking about the topic of abuse. If you have questions, call 1-888-376-6225. And we're going to start out with a question. If the abuser is not a parent, how can parents teach their children to tell them if someone touches them inappropriately?
It's helpful that the parent has strong communication with the child, and the child trusts the parent. Otherwise, they're likely not going to want to report anything to the parent. Another thing to keep in mind is something we alluded to earlier, is a majority of the time the child knows the abuser. So even though it may not be a parent, it could be an aunt, it could be an uncle, it could be their older brother or the older brother's friend, and that makes it much more difficult for the child to make that report because their question might, or their report might be invalidated, or no one may believe them. So I think first and foremost, the parent has to have strong trust and communication with the child before they might be really willing to make that report to them.
That's
so
right.
when do you start having those conversations with your kids? Because I know I have an 8-year-old, but it seems like kids grow up so much faster today than they did when I was a kid.
Yeah, so I will honestly start when I'm seeing kids in the clinic for well child visits. I'll start around 2 and I'll say, I need to look at your private parts now, but I always have to ask mom if that's okay first, because everybody has to ask mom if that's okay first.
Yeah.
And so making sure that that is just part of your vernacular, and really like bath time is a great time to do that, and saying this is, using the correct terms and saying these are your private parts and nobody should be touching these without me knowing about it or without a doctor present and things like that. Another thing that I talk to parents about is just using narratives or stories to talk about scary situations. And so I'll say, it is not uncommon that I will have a 4 or 5-year-old in clinic and I'll say, what would happen if you were out in the schoolyard by yourself and you were playing on the playground and someone comes up to you and says, I lost my puppy. Will you help me come find my puppy with me? And I will tell you 9 times out of 10, those 4-year-olds are like, absolutely, I'm going to go find that puppy for you. Sure. And the parents are just kind of like, no, don't, And so I think those stories don't have to be scary at all, but it's important to talk about what is appropriate behavior and things like that. You can adjust those stories to things like what would happen if the house was on fire, or what would happen if mom isn't responding, things like that. And those are great things to even be talking to your preschoolers about.
Right. And it can move on. I like that idea that it can move on to older children too. The pre-adolescents and the adolescents of telling stories. Or I know in clinic I'll tell a story, even make up a story of a case and where a girl was going to a party and somebody poured something in her drink. That they telling any stories like that, because sometimes they have to be educated. Just because they're older, or you think they're a teenager, that they're aware of predators and things predators might do, they still need to be educated. And storytelling is a good way to do that.
Yeah, right.
Do you ever have to worry about, when kids tell you something, having to validate it and making sure that it's not a made-up story after, they become aware that this can happen?
Yeah. I will tell you that if I am ever concerned about anything like that, I'll talk to the patient by themselves, I'll talk to the parent, and that's because I've had training in that. But if I am acutely concerned that there is abuse going on, I'll send them to Child's Voice, which is a program in Sioux Falls that just deals with pediatric abuse. And those folks are just experts in kind of sorting through those things. They have great forensic interviewers and pediatricians that specialize in child abuse. And so that is a great resource here in the eastern South Dakota area.
And I know after our abuse conference, I went home and said to talked to my son about it, and I said to him, if you ever tell me, I will believe you. And I heard that several times from our speakers, just saying, I will believe you if you tell me this. And is that powerful for parents to tell their children?
That's so important. Again, research tells us that victims of abuse, you'd think the abuse would be the thing that hurts them the most, but they clearly indicate the lack of support and lack of being believed by others was the most hurtful thing, often more so than the abuse itself.
Yeah,
It's extremely important.
It takes so much courage to
Yes.
report that, and then for people not to believe you.
Right.
Devastating.
Yeah, that would be devastating, and
Yes.
you'd be scared to ever bring it forward again.
Exactly.
Are people often threatened by their abusers? Is that a big reason why they don't bring it forward? I mean, I'm sure that children are easier to manipulate sometimes than adults.
That's
that
one
case.
reason. That's one thing that they threatening to kill the pets, kill family or the animals in the home, or someone else in the family, taking things from them, threaten them that they'll be removed from the home and put in foster care if they report. But sometimes it's other things. Maybe it's the mother's boyfriend, and the child knows that mother loves this boyfriend, so it's going to be difficult for that child to report. Or it could be a trusted person in the community, like a Boy Scout leader or someone in the church. And so that makes it more difficult for the victim to report.
And honestly, for young kids and even for elders that are dependent on other people, the people that abuse them are oftentimes the people that keep them, that make them survive, that give them their food and give them a place to stay. And so it's a really difficult dichotomy to separate those things. And so that's why it's so important to talk to those folks and say, if this is happening, we can find a place that you can have all of this support without the abuse that's going on.
So Dr. Torbert, what's involved once child abuse has been reported? Are they always removed from the home, or?
As Dr. Jackman and I were talking about earlier, I will tell you that fortunately or unfortunately, many children are not removed from the home immediately. I can tell you that in my clinic, if I have a patient that I have concerns, imminent concerns that they're being abused, I'm not going to send that patient home with a person that I think is maybe abusing them. So I'll call the police at that point and make sure that they're in a safe place. And it is different for different kinds of abuse too. The social workers that we work with, Department of Social Services, Child Protection Services, they're excellent resources for us to be able to contact and just create some sort of safe plan for those folks. And they've had education about that and things. So.
We're getting a little short on time, but Dr. Jackman, I want to give you some time to leave viewers with some final thoughts or important tips that you want to leave our group with.
Well, I believe it's important that if you see something, you should report it. You should say something. And if you're even uncertain about who you should report it to, then talk to some people that you trust in the community, your therapist, your pastor, a teacher. Ask them what direction that you may want to go. And if I'm talking to someone that is possibly being abused out there, I would certainly encourage them to speak up. Talk to a counselor, talk to a social worker, talk to your pediatrician, talk to your family practice physician, and let them know what's going on, because there's people out there that are willing to help you. They want to support you. And even though there may be some people that haven't supported them in the past, it certainly doesn't mean that there's not trusted people out there that will support them currently.
Absolutely good advice. Dr. Torbert?
Yeah, I would piggyback off of what Dr. Jackman said. If you see something, I would say something. The other thing that I would really emphasize is if you're being abused, there is hope. There is light at the end of the tunnel, and there's people that really want to support you through that. And so make sure that you find somebody that can really help you, and just create a safety plan or have an environment where you feel that you can thrive, or where those children can thrive. And so I would be an advocate for yourself, an advocate for the folks that you think might be abused.
Wonderful. Well, you both had excellent advice tonight. Thank you for being here. Thank you for taking the time to give this advice.
Thanks for having us.
And now for the winner of tonight's Prairie Doc quiz question. Why don't victims leave an abusive relationship? A, the victim fears the abuser's violent behavior will escalate. B, the abuser has threatened to kill the victim's family, friends, children, pets, and him or herself. C, the victim loves the abuser and believes he or she will change. D, all of the above. And the answer was D, all of them. It was Katie Howarth of Volga who answered the question correctly. Thank you, Katie, for participating, and a book will be in the mail to you soon. And we'll be right back.
At SD State, it's on us, all of us, to put an end to sexual assault.
To create an environment where everyone feels and is safe.
To respect that no means no.
To know that no one ever deserves to be raped.
To get in the way before it happens.
To make sexual assault unacceptable.
To stand up, to step in, to take responsibility.
We've all had to deal with bullies throughout our lives, and I've had my share. One fall day, coming home from school, I saw two guys from my third grade class beating up on a smaller kid, and was moved to step in to help. Well, the victim ran home, and I became the new target. The beating I took that day was minimal. However, the sense that I did the right thing that day by standing up against bullies has propped up my self-worth my whole lifetime. Bullies and abusers are everywhere. While in medical school, I was in an Atlanta emergency room when a woman came in with a broken nose and other broken bones and bruises that were explained away as the result of a fall, when we all knew full well they were inflicted by her spouse. Since coming to this prairie town 35 years ago, I've seen several cases of parents who physically and emotionally abused their children, and of adult children who physically and emotionally abused their parents. I remember numerous cases where women came into my office, explained their husbands were physically beating them, and despite my recommendation to escape and seek shelter, they stayed married to the scoundrels. The American Psychiatric Association defines domestic violence and abuse as control by one person over another in any relationship. Control is the operative word. The means of this control can result from physical, sexual, emotional, and economic abuse, including threats of isolation. The number of American troops killed in Afghanistan and Iraq from 2001 and through 2012 was greater than 6,000. And the number of American women murdered by male partners during that time was about 12,000. The Center for Disease Control estimates that in the United States, 1 out of every 4 women and 1 out of every 7 men will have experienced severe physical violence from a bully in their lifetimes. The National Coalition for the Homeless estimates 10 million children are exposed to domestic violence every year, and that people exposed to such hostility as children are 3 to 4 times more likely to become abusive or to be abused than people raised in families without it. Sometimes it's right to stand up to a bully, and when there's danger, it's right to escape and get help. And it's always right to save your children from a lifetime of abuse by not allowing it in your family.
I want to give a big thank you to our guests, Dr. Wallace Jackman and Dr. Nicholas Torbert. Their participation brought great insight to our discussion tonight. While we're reaching the end of summer, there's still reason to be concerned about mosquito-borne disease. State epidemiologist Dr. Lon Keitlinger had this to say this afternoon. With cooler evenings, now the risk is decreasing, but it's not yet zero risk. This year, South Dakota has had the highest incidence of neuroinvasive West Nile disease in the country. So keep using that insect repellent and minimize your exposure to mosquitoes. That does it for us tonight. Thank you for joining us for On Call with the Prairie Doc. Have a great night, everyone.
but they may come with costs. Rural health issues. Next time, On Call with the Prairie Doc.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota, and with the ongoing support of these individuals and institutions: Brookings Health System, Ophthalmology Limited, South Dakota State Medical Association, Avera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, Vance Thompson Vision, Aberdeen Asthma and Allergy, Dakota Bank, Orthopedic Institute, Physicians Care, Sanford Clinic Community Service Committee, Regional Health, and Swiftel Communications.